think what's really exciting about the next paper we're going to hear from Dr. Oliver is really looking at really great community work and doing really in-depth qualitative interviews with people. So I'll take a step backwards and say Dr. Oliver is a psychologist in training at University College London, and she's presenting findings from a qualitative study on the impact of digital inclusion initiative in a inner London NHS trust, and really thinking about digital inclusion as if these technologies and solutions don't work for people, there's really not much point in talking about them. Something could be scalable, but if it's scalable to no one, or if it doesn't get scalable to the people that need the most help, it's not really doing very much. So I think looking at not only what Dr. Oliver is going to share with us, but how she and her team went about it, it is very fascinating. So Dr. Oliver, I'm going to hand it over to you, and I'll put your paper into chat so people can see it there. Thank you.
Thanks for the introduction, John, and for inviting me here to share our research. And hello, everyone, wherever you may be attending from. So our study is a service user interview study looking at the impact of a digital inclusion initiative to facilitate access to mental health services. So a quick thank you to Dr. Julia Gillard and Ella Chandler, everyone who participated in the study. And additional thanks to North London NHS Foundation Trust, formerly Camden and Islington, and Anglia Ruskin University as well. So I'm going to blitz through the background, objectives, and methods because you can read the paper, but I'll give some context to our findings, which I want to pay a lot of attention to, and our discussion. So to begin, the digital divide has gained, there's been a lot of research in the last few decades about the haves and the have-nots, who actually has access to the digital world. And I guess the digital moving healthcare more digitally has been part of the long-term plan for the NHS in the UK for a few years now, but this was massively expedited by the COVID-19 pandemic. And as face-to-face appointments decreased, online became the new normal. And what we found is actually that I was working at Camden and Islington, now NHS, North London, and we found that our service users weren't actually able to access this remote healthcare. And we started with a trial within a smaller clinical service. And as this was successful, we expanded this to the NHS Trust. And I think, to our knowledge, it's the first of its kind. What is the digital inclusion scheme? So essentially, this was a NHS provision. We had funding for a part-time member of staff, the digital inclusion officer, and we had anyone who was a service user was eligible, and referrals came from staff or clinicians. So what the scheme provided was an initial needs assessment. And then this focused on 3 key areas, as you can see on the right of the slide. So devices, we had loan tablets, internet connectivity. This was through mobile routers with Jangala and Vodafone SIM cards, which provided data, and personalized digital skills support. So this was firstly provided by the digital inclusion officer, and any external extra referrals were to AbilityNet. And the objectives of this study was to understand the impact of the scheme on service users and identify the barriers and facilitators to implementation, and also for service users accessing the scheme. And we really wanted to provide an example to those in the NHS and within the wider community of a kind of scheme such as this, to really communicate the lessons learned and inform whether this type of scheme is feasible and acceptable within the context of an NHS trust. So the study is split into 2. So the first part is around who actually engaged with the scheme, and the second part is the follow-up interviews that we conducted. So part 1, the scheme went live in October 2021, and by June the following year, we had 106 referrals. Of those, 83 engaged with the scheme by completing the baseline questionnaire. This obtained baseline demographic information, as well as assessed digital needs and digital literacy information. contained 10 items. An example is on the screen, and we analysed the data that was included. We'll have a look at that in a second. The part 2, so this is the semi-structured interviews. We invited everyone who had engaged with the scheme because we wanted to hear their feedback. We conducted semi-structured interviews. They lasted about half an hour, and we analysed these in a thematic analysis. Much more information is in the paper, but I'm going to continue. So in total, who engaged with the scheme, so this is part 1, we had 83 service users, fairly equal gender split with a mean age of 52.4. And what we found is actually 94% required a device. Of those 94%, we provided, out of the total, we provided 93% with a lone tablet. I think there's a slight drop off because people were, understandably, it's a mental health trust, and there's various reasons why it may be difficult to contact service users, so the numbers aren't quite matching. We had 54% of service users requiring internet connectivity, and of that, we were able to provide 48% with a SIM card or a mobile router, and 69% required skill support. So this was in the first instance offered by the digital inclusion officer as standard, and a further 35% required additional support. So we referred on to a partner, AbilityNet. Some other interesting things that we found from the baseline survey was that 70% actually found COVID had made the internet, accessing the internet, more important. 37% required support across all domains, and one of the primary drivers for using technology was entertainment. So we had 2 key themes with 10 sub-themes, and this was off the back of the semi-structured interviews, and I'll talk to these in more detail now. So the factors impacting engagement with the scheme, the first and major one was digital exclusion. So every service user of the 12 who were interviewed spoke about being digitally excluded. So some quotes to illustrate: "It's just something we never could do before. We felt isolated, left behind. Before I saw my therapist, I was being assessed, but because of COVID, I couldn't go out. My computer didn't work. So in the end, it was all done on the phone." So you can see a direct impact on the healthcare that that person was receiving as a result of not being digitally included. The relationships of the trust was a key facilitator of engagement, according to the majority of people. So, for example, I think without being pushed into it by the referrer, we might never have actually ever thought we would possibly even attempt to use a device, you know. One participant, participant 11, actually found that they felt a sense of obligation to take part as it had been referred by their clinician. So all of these things have a kind of psychological element. When you're offered something by your long-term nurse or therapist, you're more psychologically inclined to please them and say, yes, I'll try that. It's a good idea. And lastly, the importance of personalized digital support. So this was primarily noted by the digital inclusion officer, who everybody really appreciated having that support. They were very friendly, approachable, made it easy because accessing services and things, I find it quite difficult. Participant 11 actually found that, like a lot of these IT schemes, there was too much understanding presumed at the beginning. And that was definitely something that we were careful to keep in mind as we progressed. Further factors impacting engagement with the scheme, so the partnership working, so this was the additional support. This was slightly more challenging. So participant 7 found that it was very short and brief, not really enough time to get things to sink in. And it was just so basic. I couldn't say if it was brilliant or not brilliant. It worked. What they said was correct. But, you know, with me and this phone, often turned off, so I just never matched up. And I think that really demonstrated the importance of having that tailored support and being able to work with service users on a one-to-one basis. Additional factors impacting engagement was the usability and accessibility of devices. This was a pro, so one participant 3 felt that they didn't feel comfortable participate in group therapy without having the device, without having that privacy element. One of the downsides was it being offered by an NHS trust meant that some of the services were limited. This was for by the IT department. So there were some things, as participant 1 notes, couldn't use Google as freely as they may want to. And finally, personal circumstances impacted on how people access the scheme. So participant 5 actually found that it was them and the loss of confidence that they had, which meant that they weren't able to engage with something new. Participant 12 also didn't engage with the scheme, but felt that it would help an awful lot of people. Not in the situation I'm in. It's my spelling ability that hindered my engagement. And again, that speaks to the wider benefits of having personalized and tailored support. And yeah. And lastly, age was a big factor that people often cited. So for example, as you get older, obviously it's a bit more difficult to pick things up. You really do need a bit more time, and I'll speak to that in the discussion section later. So the impact of accessing the scheme for participants, we'll go one by one again. So it was an improved access to services. So participant 11, it has given me a sense of, other possibilities and things like that. It's kind of, got me out of the house. And participant 7, who had never used a digital device before, now said if I wanted help or wanted to look for an organization, I would look on the tablet straight away. It also had a significant impact on the well-being of participants. So for example, in my general well-being, it's actually good for me. I'll give you 100%. And participant 4, well, maybe I listen to music, maybe I listen to something educational, depends what mood I'm in. And I think that that spoke to the broad benefits in terms of well-being that was offered by having access to these tablets and the internet. Financial implications. So some people spoke about how they were digitally excluded because they couldn't afford a new device. Participant 1, I couldn't afford to purchase a new device. It's given me time to bridge that gap so I can afford to buy myself something when the loan finishes. Participant 8 had a slightly different take. For them, I use internet banking, so it has been paramount. So it enabled them to manage their finances more efficiently. And all spoke to a greater sense of empowerment, even if they didn't engage with the scheme. So participant 8, I was writing down appointments on a piece of paper. I've been able to manage myself a bit better since using the tablet. Participants 10 spoke to how actually it's not just healthcare services, but it's wider public services that are moving online. We look up things like pensions, changes to universal credits. And finally, participant 7, who wouldn't have engaged with the scheme had this not been an option, because they wouldn't have had the first idea on how to switch it on. So to a discussion. So firstly, our findings aligned with prior research on the digital divide and how COVID had impacted on people's ability to access healthcare and wider services, and also on their well-being, often in a detrimental way. As I mentioned, age was a big factor that participants mentioned, particularly stereotypes around age and how that influenced their ability or their perceived ability to engage in this technology. Staff played a crucial role, both with clinicians referring service users to the scheme, but also the digital inclusion officer being a pivotal point of success for the scheme and how that tailored support really helped engage service users. There's challenges advertising the scheme, and the irony is that people who are digitally excluded don't have access to emails in the typical ways that we would share these around. So we kind of resorted to paper methods and word of mouth, but that obviously had limitations. The importance and impact of the scheme, even for those who didn't really engage, spoke about how it would benefit others, and how those who did engage spoke about how it benefited them by enabling them to access healthcare, education opportunities, social, connecting with relatives during the pandemic, accessing government services, pensions, benefits, that kind of thing. Limited resources was a problem that came up within this study, but also on a lot of the other examples we found within the community, a limited number of devices or money. And I think organizational support was a big factor. Where does this sit within NHS Foundation, within an NHS trust? Does it sit with the clinical services, or does it sit with IT? And that kind of stopped the scheme continuing in the end because that was a bit of a predicament that we couldn't figure out. So limitations, as always, there's challenges in evaluating person-centered programs, whether or not people felt social desirability bias and actually wanted to say the right thing in case it impacted their care. We obviously took great pains to say that it wouldn't, but you never know. We also, as I spoke about, contacting participants exposed to digital divides. How do you get hold of people who don't have text message or emails? Is there a need for digital inclusion initiatives post-COVID? Now society's kind of gone back to how it was in a way. I feel like the long-term plan of the NHS is still looking at digital healthcare. And again, there's a debate around if we only offer online, does that mean that we don't have in-person appointments and stuff? And I think that that needs to be carefully balanced. Lastly, final slide, lessons learned. So understanding service user motivation and need is absolutely crucial. And particularly having a dedicated digital inclusion officer is a vital resource to be able to do that. Gifting devices may allow for greater engagement. People may feel more comfortable using them when it's their own, or I think also considering the specific use and accessibility of loan devices is crucial, whether it's for privacy, whether it means that people can use it for certain things. Everybody had their own different need. And lastly, schemes should be tailored to those who need it and want it most. So we need to find the people who are digitally excluded and find a way of putting this in front of them. And
Yeah.
that is all. Thank you.
Thank you, Dr. Oliver. It's so impressive that you were able to do that work. And really, those quotes speak to the challenges, right? Just even someone saying, well, it depends on my mood. It's not going to be always constant. It's not always yes. It's not always no. And I do love your point of where does this even sit? Is it in the clinical realm? Is it in IT? I feel like you could do a whole different study with the same methods talking to those stakeholders of where these projects live. And that relates to one question in the chat of you said that the project ended. It makes sense. Most projects have a beginning, middle, and end. Could you speak more to where the shared learning of that can continue? Are there ongoing efforts? I put the link in the chat so everyone can see the paper of what you did. But is there any kind of part of this that may be ongoing or parts that you're even planning to have ongoing?
I think, as always within the NHS, changes of personnel, it meant that the people who initially implemented and facilitated the scheme moved on. And I think whilst there was a kind of fight to keep that being administered by the trust, again, where did it sit? Who was going to take on that extra burden of work? I think that kind of curtailed it earlier than we would have liked. I think that there needs to be a decision around, yeah, where does it sit? And it benefits clinical work so much. But yeah, it's a difficult one.
And to add to difficulty, here's a very difficult question. We'll try to do in 1 minute. Imagine that there was an AI platform. Could an AI platform help with some of these things in reaching people? Clearly, we know that technology is not going to solve it, but could some of your lessons be put into one of these chatbots? And do you see potential there?
It's tricky. I think one of the big things that we found was actually having an in-person resource, a digital inclusion officer, was able to, particularly for risk and safeguarding and being managed by a clinician. I think that that's things that AI might not necessarily be the best at right now. I guess the once people had access to technology, you could probably have some, yeah, very
Yeah.
effective programs to help people gain those digital skills. But yeah, it's a big question.
But I agree with you. And here in Boston, we call it a digital navigator. Again, the same concept, just different. But I do think it's a human being. But there is a lot of interest in saying what roles of it could AI do, which makes sense. We want to see technology do different things.